Leukemia encompasses various cancers that affect blood cells, help spread awareness, with the specific type of leukemia being determined by the type of blood cell involved and its growth rate. While it most commonly occurs in adults over 55, leukemia is also the most prevalent cancer in children under 15. This condition impacts the production of blood cells in the bone marrow, primarily leading to abnormal growth of white blood cells but also affecting other types, such as red blood cells and platelets. Leukemia comes in several main types, including 1. Acute lymphoblastic leukemia, ALL, which affects lymphoid cells and progresses quickly, more often affecting children but also occurs in adults. 2. Acute myeloid leukemia, AML, affects myeloid cells and snowballs, affecting both children and adults. 3. Chronic lymphocytic leukemia, CLYA, is a slow-growing leukemia that affects mature lymphocytes and is more common in older adults. 4. Chronic myeloid leukemia, CML, affects myeloid cells and progresses more slowly than acute forms, occurring at any age but most commonly in adults. Leukemia presents a range of symptoms, such as tiredness, weakness, susceptibility to infections, easy bruising or bleeding, and swollen lymph nodes. Diagnosis typically involves blood tests, bone marrow aspiration, and genetic analysis of the leukemia cells. Treatment for leukemia is determined based on the type, stage, and other factors. Standard treatment options include chemotherapy, targeted therapy, radiation therapy, stem cell transplantation, and immunotherapy. The choice of treatment is personalized to meet each patient's specific needs. Although leukemia can affect individuals of all ages, it is more frequently diagnosed in adults aged 55 and older. Nonetheless, it remains the most prevalent cancer among children under 15 years old. Medical advancements have improved outcomes for many leukemia patients. Early detection and appropriate treatment significantly enhance the likelihood of a successful recovery. Below is additional information regarding leukemia. 1. Factors that increase risk. Although the exact causes of leukemia are often unclear, certain factors can elevate the chances of developing the disease. These include exposure to ionizing radiation, specific chemicals like benzene, certain genetic conditions such as Down syndrome, a family history of leukemia, and previous treatment with particular chemotherapy or radiation therapy for other cancers. 2. Manifestations. The symptoms of leukemia can differ based on the type and stage of the illness. Common indications encompass fatigue, weakness, fever, night sweats, unexplained weight loss, frequent infections, easy bruising or bleeding, such as nosebleeds and gum bleeding, swollen lymph nodes, and bone or joint pain. 3. Treatment modalities. The treatment strategy for leukemia is contingent upon the precise type of leukemia, its stage, and the patient's overall health. Potential treatment options may involve: chemotherapy involves the use of drugs to either kill cancer cells or slow down their growth. Targeted therapy utilizes medications targeting specific molecules or proteins implicated in cancer cell growth. Radiation therapy employs high-energy X-rays or other types of radiation to destroy cancer cells. Stem cell transplantation is a procedure in which healthy stem cells are transplanted into a patient to replace damaged or cancerous cells. Immunotherapy is a treatment that enhances the body's immune system so it can identify and attack cancer cells. Watchful waiting may be recommended as a watch-and-wait approach for certain chronic leukemias, where the disease is progressing slowly and not causing symptoms. 4. Leukemia prognosis varies greatly based on factors such as leukemia type, stage at diagnosis, patient age, and treatment response. Aggressive treatment is necessary for some types, like acute leukemia, which can lead to a better chance of cure if caught early. Chronic leukemia can be managed over time, allowing some patients a good quality of life for many years. 5. It's crucial to manage the side effects of leukemia and its treatments through supportive care. This may involve blood transfusions to address anemia or low platelet counts, antibiotics for infections, and medications to alleviate pain and other symptoms. 6. Ongoing research and clinical trials continuously enhance our understanding of leukemia and treatment options. New therapies and approaches offer hope for improved outcomes with fewer side effects. If you or someone you're close to has been diagnosed with leukemia, it's crucial to seek advice from a medical team with expertise in treating this condition. By exploring treatment choices and developing a customized care strategy, early detection and the proper treatment can significantly influence the outlook for leukemia patients. Matthew, thank you for spreading awareness, and I hope this video reaches a broad audience. Please just take a few moments to subscribe and comment on the YouTube channel.